All right, everybody. Good afternoon, good evening, good morning, wherever you may be. Dr. Brandon Money here. If you are seeing this, that means you're on the Centeno Schultz Clinic Facebook page. Um, in the future, we will also be on YouTube at the same time. However, there was a little bit of technical difficulties, but that's okay. We will get this posted, the recording posted to YouTube as well as Instagram and perhaps some other social media outlets. But my name is Dr. Brandon Money, physician at the Centeno Schultz Clinic, world leader in orthobiologic-based treatments. And today we're going to be kicking off our top 5 golf webinars with the shoulder. So we're going to be talking specifically about golf swing injuries related to the shoulder. And even if you're not a golfer, you've never picked up a golf club, you may still get something out of this simply because injuries do happen to the shoulder in many, many other individuals other than golfers. Okay, let's go. All right, a little bit about me. So I am board certified by the American Board of Physical Medicine and Rehabilitation. I am fellowship trained in interventional orthopedics here at the Centeno Schultz Clinic and stayed on as an attending physician after my fellowship was complete. I am also certified by the Titleist Performance Institute. And so TPI for short, it's a network of golf teaching professionals, physical therapists, chiropractors, physicians, strength trainers, and other experts that have additional training in how the golf swing and the body work together. And as a result, although my wife would probably use the word golf obsessed, but I prefer the phrase golf enthusiast myself. There's my Instagram, post different things related to golf, related to other things on a regular basis if you want to check that out and follow me. Okay, so to the shoulder. Before we talk about conditions, we need to talk a little bit about anatomy. So lots of different structures make up the shoulder. There's 4 rotator cuff muscles. They're the supraspinatus, the infraspinatus, the subscapularis, the teres minor, other muscles as well. They help provide stability and movement to the shoulder itself. In addition, we have the biceps tendon, which helps provide movement of the arm. Also, it is an anchor point to the very top of the labrum, which we'll get into a little bit later. There's 2 main joints that make up the shoulder. We have our glenohumeral joint. That's the main ball and socket joint, or what I like to refer to as a golf ball that sits on a sideways golf tee, because that's how it looks if you look at it via pictures. Also, the acromioclavicular joint, also known as the AC joint. AC joint is the top joint of the shoulder. So if you feel the top of your shoulder, you'll feel the bones that are right there. AC joint is right there. It's where your collarbone comes across, meets with the top of your shoulder blade. In addition, not a true joint itself, but we have the scapulothoracic articulation. That's where your scapula or your shoulder blade has to move on top of your rib cage in order for your arm to be able to move. And so, in addition, we have ligaments and the joint capsule itself. Ligaments are basically pieces of duct tape that help provide stability to that shoulder, make sure that that golf ball sits on that golf tee as we're moving our shoulder around. And then we have the labrum, which is essentially a ring of rubber type tissue that wraps around the golf tee to give it a deeper socket to help, once again, with stability of the shoulder. And so, we're going to dive right in. Number 1 injury related to golfers is rotator cuff injury. Again, there's 4 muscles of the shoulder. In this graphic, you can see how they're oriented. So anterior view on the left side means you're looking at it from the front. Posterior view means you're looking at it from the back. And so the subscapularis has been shown to be the most active muscle of the 4 in the golf swing. And so it helps provide internal rotation, which is most prominent on the downswing of the trail arm. And so if you're a right-handed golfer, that's your right arm. If you're a left-handed golfer, that's your left arm. In addition, the supraspinatus itself can become impinged and get irritated between the humerus, which is the arm bone, and the acromion, again, that top of that shoulder blade bone, because that muscle and tendon tissue have to travel between those 2 bones to attach to the outside part of the shoulder itself. So, a few little definitions here, because there's lots of different terminology when it comes to injuries of a tendon. And so, saying the word tear is like saying the word car. many different kinds. We've got Hondas, we've got Porsches, we've got Ferraris, Chevys. You get what I'm saying. And so the vast majority of patients I see that have rotator cuff injuries fit within the first of these three categories here, either normal, partial, or full thickness non-retracted. And so it's quite rare that I actually see a patient that has a tendon that's completely ripped in half unless there's some major traumatic injury that has occurred. And so when we're talking about tendinosis, that's a chronically irritated, swollen, inflamed tendon. There's probably a few small tears in there. A partial tear means some of those tendon fibers are torn. Full thickness tear, the tear extends through the entire top to bottom of the tendon itself. And then a complete tear means the entire tendon, both thickness and width, are torn. And so retraction basically means those torn fibers have pulled apart. Think of a tendon like a bundle of spaghetti sticks before you drop it in boiling water after you've taken it out of the box. And so technically one broken spaghetti stick is a torn tendon. My patients have heard this analogy over and over again. But one broken spaghetti stick is entirely different from the entire bundle like this and pulled apart. Way different, likely needs completely different treatments. Okay, number 2, biceps tendonitis. So biceps tendon itself is used to flex the shoulder. That means bring the arm up. Also flex the elbow, as well as supinate the wrist. So bringing that wrist out instead of down and in. The biceps tendon itself travels in front of the shoulder. There's actually 2 muscles. Biceps actually means two-headed. And so there's 2 muscles. One attaches to the very top of the labrum as it makes that 90-degree turn. That's the long head. Short head attaches to a bone in the front of the shoulder. And that can become irritated with repetitive use. Also can be traumatic in nature as well. Now, this is an ultrasound image of the of the biceps tendon itself in the front of the shoulder. And so that biceps tendon can sublux or pop out of this groove that we see on the top and front of the shoulder. And usually if that happens, there's an injury to the subscapularis because the subscapularis lies adjacent to the biceps tendon. And if that subluxation happens where that tendon is moving back and forth in and out of that groove, that can further irritate the tendon and potentially result in more severe injury down the road. Number 3, glenohumeral joint instability. And basically what we mean by instability is things are moving around more than they should. And so, like I said, think of the shoulder that's like a golf ball that sits on a sideways golf tee. That's essentially the glenohumeral joint. We rely on a number of structures to help keep that ball on that tee as we move our shoulder. The ligaments, the labrum, the muscles, the rotator cuff tendons, and the joint capsule itself. And so the beautiful thing about the shoulder is that we have so much mobility, so much range of motion. There's no other part in our body where we can do almost a 360-degree rotation like this. Unfortunately, a cost of that mobility is that the shoulder is an inherently unstable joint. And so due to that, all of those other structures have to help provide stability. And so if there is instability, that can result in the joint subluxing, meaning that that golf ball slides up, down, left, right on that tee, or dislocates or completely pops off of it, which the instability itself, even if it's to a very small degree, can increase the overall wear and tear to the joint itself, which can result in osteoarthritis, which is wear and tear on a joint. Can also worsen rotator cuff injury because that means the rotator cuff tendons, if they're already damaged, have to overwork to help provide that stability to the shoulder itself. Okay, so on to number 4, labral tears. I can't tell you how many times every single day we have patients that come in. We got to get it fixed. Well, the labrum itself, again, acts like a gasket surrounding the glenoid, which is essentially the golf tee or the socket. And so it helps provide stability. And due to the fact that it's a rubbery type tissue, it can become damaged by either direct trauma, a dislocation, or just normal wear and tear of the shoulder itself. And this type of instability is often missed on an exam because you have to do a comprehensive physical exam in order to identify some of these structures that they might not be torn to a significant degree, but there may be these little findings that we see that others may not recognize because they don't look or they don't know how to test. And so most labral tears are degenerative in nature, usually as a result of that shoulder instability, moving around more than it should. And so that chronic instability can result in damage to the labrum. Some of these labral tears that we see in this photo here are often degenerative in nature, and it's very commonly not the source of shoulder pain. And so that's why you need an expert that can actually get to the source of your condition, not just look at a report from an MRI that shows a labral tear and just assumes that your symptoms are coming from that. Because very, very common, especially as we continue to add candles to our birthday cake and get older, that we find labral tears, but doesn't necessarily mean that's what's actually causing the symptoms, the dysfunction, the pain that you may have. Next, frozen shoulder, also known as adhesive capsulitis. Basically, it means that the joint capsule and the ligaments that help surround the capsule get inflamed, get tightened, and it's basically like wrapping that shoulder joint with a whole bunch of saran wrap over and over again, and it doesn't allow the shoulder to be moved. And so that can significantly limit the range of motion of the shoulder, causing stiffness, causing pain of the shoulder itself. And so frozen shoulder has 3 phases of the disease. So a freezing phase where things are continuously slowly tightening down. Range of motion is worsened over time. Then we have the frozen phase where things are stuck, very limited range of motion, particularly with internal and external rotation. So if you have your arm at your side, right next to your rib cage, your elbow bent to 90 degrees. Internal rotation is taking your palm towards your belly. External rotation is taking your palm away from your belly. Like this is internal rotation downward. External rotation is upward. Okay. Now, with the shoulder itself, we can have specific movements in the golf swing that can either be a result of injuries or that can be a cause of the injuries themselves. And so it's almost like a chicken or the egg type thing. So, for example, if you go over the top with your swing, and golfers will know what I'm talking about, that can increase the strain on the rotator cuff itself. If you consistently take fat divots at impact and chunk the ball, that impact itself can create trauma specifically on the lead arm. So, opposite arm compared to whatever handed you are. If you have limited follow through, that increases the forces on the rotator cuff as you slow down because the golf swing itself isn't over once the ball's been struck. A lack of follow through and trying to rapidly slow down your upper body and your shoulders can increase the stress on the rotator cuff and on those structures themselves. And so I'm going to give you a little hint of what the insiders do. This is what the experts do. This is what I do. This is what the doctors here at the Centeno Schultz Clinic do. This is what the professionals do. They find a physical therapist, a chiropractor, a golf instructor, a golf expert that is TPI certified. And so what that means is we all speak the same common language with respect to the golf swing. I think it's 48 out of the top 50 golfers in the world work with a TPI expert. Don't quote me on that specific number, but it's very, very high. And so that would be the first thing. In addition, if you're carrying around too much weight, like a lot of people have done since COVID 4 years ago, we need to get that weight off. That adds stress to our body. Lifestyle modifications. And so that's increasing the exercise, the physical therapy. If you're a smoker, stop. If you're a heavy drinker, cut down. No alcohol is good alcohol. All of those things, what I call the easy things that we can do that don't require me, that don't require a therapist, don't require a chiropractor, that you can do on your own. And then if you're still not where you want to be, consider some type of orthobiologic treatment, such as platelet rich plasma or PRP, which helps promote tissue healing and tissue repair. One thing I would avoid is high dose cortisone or steroid injections, because we know that that type of injection is toxic. That material, that injectate, is toxic to tendon tissue, ligament tissue. It can further accelerate degenerative arthritis in the joint itself. And of course, surgery is absolute last resort in any circumstance. And the way I treat my own body, what I recommend to my family, my close friends, is that I want to make sure that we've done everything possible prior to surgery before we go get operated on. And ultimately, even if you have to undergo surgery, a recent study that I found showed that about 76% of golfers who had rotator cuff repair ended up returning to play at a level near before whenever they had surgery. So let's talk about PRP. Again, that stands for platelet rich plasma. So what is it? Maybe this is the first time you've heard about it. If you're a fan of our page, fan of the Centeno Schultz Clinic, a previous patient of the Centeno Schultz Clinic, or current patient, I know you've heard about it before. So PRP is essentially a preparation of concentrated platelets from your bloodstream. It comes from you, it goes back into you. And those growth factors that are inside the platelets help boost tissue repair and tissue healing. And we have found over the past 20 to 25 years that this helps treat certain musculoskeletal conditions. So tendon issues, ligament issues, into the bone itself, joint structures, any and all of those, nerves as well, can all be helped from a tissue repair and tissue healing standpoint with PRP. Now, I've got some warnings for you. Just because somebody says they do PRP, what does that mean? Not all PRP is the same. Dosage is key. So what are they actually injecting? If you ask that question and they can't answer, run away. Get out of there. There's too many clinics nowadays that have inadequate training, inadequate safety protocols. Too many clinics do blind injections without image guidance. So they're just randomly sticking a needle where they think it's going to go. Well, we're humans. We're not robots. We're all a little bit different. And if I'm injecting somebody, I want to make sure that that needle is going exactly where it needs to go. Number one, because it needs to go where it needs to go to have the desired effect. These cells and these healing factors don't have a magic homing beacon to know where to go. We've got to put it exactly where it needs to be. And way more important is that we want to stay away from structures that we don't want to touch, like nerves, for example. And I can't see those without image guidance. And I want you to do your homework. Are you going to see the doctor? Are you going to see their NP or their PA? Who's going to be doing a treatment? Now don't get me wrong. They're great providers. My wife's a PA, but they don't have the adequate training and the expertise to be able to do what we do. And the best in the world have specialized training in orthobiologics, certified by the Interventional Orthobiologics Foundation. Non-physician providers, they simply don't have the training, the education, the expertise necessary, not only for the diagnosis, but the management of these often complex conditions. So questions to ask. If you walk in, you've got to ask these questions because you have to be educated as a patient so you can ultimately make the right decisions. And so how is the PRP prepared? What's the concentration? Are there red blood cells? Are there white blood cells? What type of image guidance is used for the injections themselves? Anybody that's worth their salt is going to be using ultrasound and or x-ray or fluoroscopy for every single injection. What structures specifically are being treated for your condition? Because your condition is different than the next person that walks through that door. There's no cookbook for this that says this is page 37, this is the shoulder page. Humans. And why are they being treated? What other options are available? There's lots of different ways to treat things, both surgically, non-surgically, orthobiologics, non-orthobiologics, all of that. And because my job is to educate by and large, that's number one. So that way you as a patient can have the information available so you can ultimately make the best decision that's in your best interest. And in addition, did the physician undergo specialized orthobiologics training and fellowship? I've taken many, many weekend courses when I was in residency, fellowship, and now as an attending, as well as my year-long fellowship to be able to learn this type of medicine. It's not something that you can become an expert on just by going to a weekend course or two. It requires constant, consistent training as well as practice. This is all we do at the Centeno Schultz Clinic. All we treat are neuromusculoskeletal conditions. We don't treat spinal cord injury, brain injury, MS, autoimmune conditions, any of that, because we are the experts in them. Next slide. All right, a little about our Centeno Schultz Clinic. Here in Broomfield, Colorado, just outside of Denver, we are the world leaders in orthobiologics treatment for musculoskeletal conditions. And so we've invented many of the procedures that are used now across the world. We do constant research and evolution of our procedures because the more we learn, the more we can help our patients. The past couple weeks, we've actually had our final study published, and it's not actually on this list because it's too new for this list. And so this was rotator cuff tears that were treated with bone marrow concentrate. And so while it wasn't specifically for golfers, at the 12 to 24 month mark, patients had an 80 and 89% improvement of symptoms, respectively. Okay, some final thoughts. The golf swing itself is complex. It's individualized. I've never met two people that have the same swing. Probably won't ever. Your injury, your condition needs a specialized evaluation and plan dedicated to you. My recommendation, we start conservative. We advance to the next step if we need to. If you've never done physical therapy, I'll send you to a physical therapist. Then we never have to do anything else. That's the best job I can have. It's all about progress, not perfection. Professional golfers didn't become professionals overnight. The body didn't get the way it did overnight. Your body didn't get the way it did overnight. It takes that progress. And if you'd like to learn more, please visit both our CentenoSchultz.com website as well as RegenX website. Lots and lots of information available to you. If I haven't answered any questions, please feel free to reach out to me directly. Always happy to answer questions for you. If you have any comments, please post a comment. I'll try and get to them whenever I can. And then last slide here, we've just got some references from where my data came from. Once again, if you find yourself not being able to sleep at night, please download these or review them, and you'll find yourself sawing logs very quickly. That's a joke. But anyway, thank you guys for tuning in. Thank you for watching. If you're not watching live and watching on a delay, again, we'll post this on YouTube as well as Instagram and other Centeno Schultz social media outlets. Dr. Brandon Money here. I hope you all have a wonderful evening. Hit them well, hit them straight. Enjoy your summer of a wonderful golf season wherever you may be. And of course, enjoy the Open Championship this weekend.